to the fathers, Yahweh, Yahweh, Yahweh. You made the dry bones live again, Yahweh, oh, Yahweh. And you picked me from the mountain, Yahweh, Yahweh, Yahweh. Oh, no one can love me like you do. God of wonders, mighty ruler, you deserve all the glory. Yahweh, Yahweh, sing God of wonders, God of wonders, mighty ruler, you deserve all the glory. Yahweh,
Okay. Do you want to take a little bit of water before starting the process?
By the European Center of Disease Control as any infection on the skin and subcutaneous tissue at the operation site. The depth of tissue and any organ or space other than the skin that was manipulated within 13 days of procedure. During each group proved that cervical cancer infections are more reported than for healthcare associated infection in low and middle income countries with an incidence of 11.8 cases of cervical cancer infection per 100 surgical procedure. The rate of cervical cancer infection after cesarean section ranges from 3 to 15% depending on hospital use, the patient population, and the use of antibiotic prophylaxis. Goldman et al. In 2021 had reported different rates of cervical cancer infection in African countries as 90% in Kenya, 16.2% in Nigeria, and 10.9% in Tanzania. While in Cameroon, the rate of cervical cancer infection in local hospital in Yaoundé was 1.81%. And in Douala in Latincy was 28.8%. Risk factors of cervical cancer infection in the developing countries are more than the developed countries due to malnutrition, anemia, poverty, and poor antibiotic selection, or the inability of immunocompromised patients to fight against the infection. Cervical cancer infection is a problem in our health system of developing countries, frequently infection is a problem that the health system of the developing country frequently makes. Post-discharge cervical cancer infection in the developing country needs to be improved due to the fact that many cervical cancer infection occur between 5 to 10 days after the surgery. You have few studies in your setting that use post-discharge follow-up to diagnose cervical cancer infection. And in relation to this, it's important to increase study on incidence and risk factor of cervical cancer infection in our setting to improve quality of health. We therefore have this general objective to assess the incidence and risk factor of cervical cancer infection post-discharge in Lakentini Hospital and Royal Gynecological Setting and Pediatric Hospital. As specific objective, to determine the incidence of cervical cancer infection and the maternity rate of Lakentini and Royal Gynecological Obstetric and Pediatric Hospital, to compare the two incidents and to look for the risk factor associated with the infection. In order to attain our objective, we conducted a hospital-based cross-sectional study done over 3 months in Royal Gynecological and Pediatric Hospital and Lakentini Hospital. Our study population were all women gave birth by cesarean in the two hospitals. We included all patients who developed cervical cancer infection and all women who gave the written consent to be part of the study. And we excluded patients operated in other hospitals, patients with other post-operative complications, and patients who drop out before the end of the study. We drafted the consent special protocol and upon approval, we obtained the ethical clearance from Institutional Review Board of Functional Science, the administration clearance from Functional Science, Lakentini and Royal Gynecological Hospital. Introduction of ourselves to the various health and environment and the patients to obtain the written consent. Then the patient were followed up for 14 days post-surgery according to the study done by Remy and all 2017, who reported that most of the cervical cancer infection were occur between 5 to 10 days after the surgery. And the patient case files and cervical were corrected for confusion of questionnaire and then follow-up for data analysis. The data was collected using an questionnaire and safely stored. Information was then extracted from the questionnaire entered to the Microsoft Excel for exploratory analysis in order to constitute a database. Then this data was exported into a Info7. Categorical variables like level of education, gravity and variety were represented as frequency and percentage. And while continuous variables like age, body mass index were expressed as mean, median, and standard deviation. P-value less than 0, a chi-square test were performed to test for significant association between risk factor and outcome value. A p-value less than 0.05 were considered statistically significant. The association between cervical cancer infection and risk factor was done indivisible by variable and multivariable physical regression model and reported as correlation, adjusted proportion, and 95% confidence interval. Honorable member of the jury, our results and discussion. During the study period, 31 women were followed after cesarean from Royal Gynecological and Pediatric Hospital. 67 for Lakentini Hospital give us a total of 98 women who gave birth to cesarean section. 8 were excluded because they dropped out before the end of the study, giving us 95 participants at the final analysis. In the above table, most of the participants in our population were between 20 to 39 years. Besides, most were unemployed and have a basic education experience. And about 61.1% were referred from pediatric hospital. During the study period, out of 95 women were followed after cesarean section, 11 patients developed cervical cancer infection, with 2 in Royal Gynecological and Pediatric Hospital and 9 in Lakentini Hospital. Gave us a cumulative incidence of 11.6%, 95% confidence interval of 6.6 to 19.6%. The type of cervical cancer infection found was superficial cervical cancer infection with 4.2%, deep cervical cancer infection with 6.3%, and organ space cervical cancer infection with 1.1%. All cervical cancer infection occurred between the 6 to 14 days post-operation. This was similar to the study done by Amir et al. In 2019 in Lakentini Hospital. The incidence of cervical cancer infection in our population was in line with the study done by in Southwest Ethiopia by Amuno and all in 2011, who had an incidence of 11.4%. However, this one findings is higher when compared with incidence of 1.81% done by Fojon and All in Yaoundé in 2021. This discrepancy may be due to the fact that this study was a prospective study and there were no use, including the use of post-discharge surveillance. Our incidence rate is also lower when compared to 48.2% in Tanzania done by Lelado and All in 2016. The difference might be possible due to the sample size and the duration of the post-discharge surveillance was 30 days. You can see on the chart that the incidence of cervical cell infection in HO2 was 6.7% and 13.8% in Gordon and Boston and Pediatric Hospital and Argentina respectively. The difference can be explained by the fact that in the first period, Gordon and Boston and Pediatric Hospital is a tertiary hospital, while Argentina is a secondary category referral hospital, which means that the traffic in the first is probably more complete than the one in the second. Secondly, majority of patients in Argentina was referred, means that they were probably sent in an emergency state. According to the study done by Zaid and All 2016 and finally, the infection prevention measure is probably not optimal in Argentina. For example, the use of chlorhexidine in Argentina for rather than Bovidon ID which is the best in terms of antiseptic soap insertion according to publication. After immunoglobulin analysis, patient with post-operative, preoperative anemia were 4.7-fold more likely of having cervical cell infection, and patients with diabetes were 8.4 more likely to have cervical cell infection. Preoperative anemia as a risk factor of cervical cell infection was allowed in labor and all 2020 and children, and it's probably worse in our setting because of the presence of malaria. This condition can affect the immune process of the wound and increase the risk of cervical cell infection. Diabetes as a risk factor of cervical cell infection was allowed in Kawakita and all 2017 and Martin and all 2016. Diabetes is a metabolic disease characterized by chronic hyperglycemia. It can cause some modification in the vascular and immune dysfunction, which may put the patient at risk of cervical cell infection. Additionally, we found that patients who received blood transfusion were 16.64 more likely to have cervical cell infection than those without blood transfusion. Transfusion induced renal dilution because study done by UNICEF and all 2017 showed that the recipient may have renal suppression following her transfusion and were prone to infection through the surgery. For the strength of our study, this is one of the few studies including post-discharge surveillance to look for incidence of cervical cell infection in our setting. Our limitation was the fact that we had a small sample size and a short study period, which did not help us to have more risk factors that were associated with cervical cell infection. Difficulty to have information from referral patients, and we studied only 2 referral hospitals, which might be no representative of all the general population. We therefore conclude that the rate of cervical cell infection post-cesarean section in our population is high. The incidence in Argentina is higher than the one in Ghana than the co-occlusion and obstetric pediatric hospital, and the significant factor for cervical cell infection were as follows: preoperative anemia, diabetes, and blood transfusion. Based on the conclusion, our study will make the following recommendation to the hospital: make sure to improve the assessment technique. To the pregnant women, we encourage pregnant women to attend antenatal care to be able to receive first against malaria and anemia, to sleep under mosquito net. Monsieur le Président du jury, honorables membres du jury, Mesdames et Messieurs, notre jury. Les infections du site opératoire sont des infections des développements survenant au niveau des plaies opératoires. Dans les 30 jours suivant une infection chirurgicale, elles peuvent être superficielles, profondes ou d'organes. L'infection du site opératoire est une des complications qui survient pendant les périodes post-opératoires avec un coût rapportant de 3 à 15%. Une incidence de 1,81% a été retrouvée dans les hôpitaux référents de Yaoundé et de 28,8% à l'hôpital de la Quinzaine de Douala. Les facteurs de risque dans les pays en voie de développement sont plus nombreux que dans les pays développés, en raison de la malnutrition, l'anémie, la pauvreté, une pauvre sélection d'antibiotiques, l'incapacité des patients de lutter contre les infections. Notre étude avait pour but de déterminer l'incidence des facteurs de risque associés aux infections du site opératoire, après césarienne, dans les deux hôpitaux de référence de Douala, à savoir l'hôpital gynéco-obstétrique et obstétrique et pédiatrique de Douala et l'hôpital Argentine. Une étude prospective transversale a été menée à l'hôpital Argentine et l'hôpital gynéco-obstétrique de Douala de février à avril 2022. Notre étude consistait à suivre tous les patients ayant subi une césarienne pendant 14 jours pour détecter celles qui développeront les infections du site opératoire. Les facteurs associés aux infections du site opératoire au début étaient l'anémie profonde, la tension sanguine et le diabète. En conclusion, l'incidence des infections du site opératoire dans notre étude était élevée. L'incidence retrouvée dans l'hôpital Argentine était plus élevée que celle retrouvée dans l'hôpital gynéco-obstétrique de Douala. Les facteurs associés les plus fréquemment retrouvés étaient l'anémie opératoire, le diabète et la transfusion sanguine. Je vous remercie.
Appreciating the work, following the flow we are observing. Let me remind you again that now the process is to refine it. If there's a question that you don't understand, you'll be ready to. Is it okay?
Yes, we do.
Now, before going on to the process, let's, in front of the attendees, acknowledge my recognition to my two colleagues. Dr. Elan, who is the Chief of the Service of Obstetric and Gynecology of the Regional Hospital. It's an opportunity for me, my dear brothers, to acknowledge your commitment to the treatment of those young physicians. Dr. Chunzu Robert is also an opportunity for me to acknowledge your commitment to take care of this student. I remember that per week you move from Douala to here, taking the risk of traffic, so that tomorrow the prosperity will have opportunity to be in good health. So thank you very much for that particular Dr. Elon Brown.
Our candidate is Sama Nimes Elise Guilhem for this brilliant presentation. I will start by telling the audience that this is an academic exercise. This book, written by your person, your daughter, your friend, your wife, I don't know, this document will remain here at the faculty. It will remain at the library of the faculty as a reference document. So we cannot allow this document to go there without criticizing it. Because in the document, the references of the document will carry names of Professor Nana, Dr. Chunzu, I, Dr. Elon, Professor Egbe, and Dr. Chunzu Robert. So we want to render it correct before we put it at the library. So let me start by appreciating the way our candidate is dressed now. Well, dressed like a real African, not a lady, a woman, who are well dressed, and it is very, very important to be well dressed when you come to such exercises. It shows that you take it very, very seriously. You are well dressed. Concerning your presentation was good. You have succeeded to project your voice so that even those who were behind will listen to you. The minor problem that I noticed there is that we were going a little bit fast. Are you getting me? Well, we were going a little bit fast. When you go fast like that, people don't have time to digest what you are saying. Before they digest it, you are only saying another thing. So next time, for the next presentation, in another occasion, I want you to go a little bit slowly. You have shown us that you master your topic. You master it. I saw you presenting and at the same time having a kind of eye contact with the audience. There also I have another remark, is that the eye contact was targeting the president only. So you negated us and even the audience. Because you're not only talking to him, you are talking to these people, you are talking to these people who have come here, because at the end of this presentation, they have to keep something in their mind. That day, is presented on this. So your presentation is for the president, is for the members of the jury, and also for all the audience. Concerning the slides, I have to say sincerely that the slides were visible, the font size were good, the tables were easy to read and to understand. And as far as your slides are concerned, I don't have so much to say. I have to say that I will appreciate the work done by the supervisor, Professor Egbe, who I know very, very well, and also with Dr. Chunzo. When I see their names in the work, show that it is something good, because they are very, very serious supervisors. Now let's start with this. I saw the title of your presentation, Incidents and Risk Factors of Postpartum, of Post-Caesarean Surgical Site Infection in 2 referral hospitals in Rwanda. Is it possible for you to tell us, or to tell the audience in simple terminology, what is this? To explain the title, just in simple words.
Thank you. Ladies and gentlemen, my work was based on the incident that I was looking for the new cases of surgical infection. Surgical infection post-cesarean sections. So when a woman comes for the hospital for the cesarean section, after the surgery, I will follow the patient for 14 days. 14 days on a study. And if the place where for the surgery, the place where the simple one where they cut in the abdomen, well, there was no sign of infection. So I was looking for the new cases of surgical infection, and the risk factor that was around this to have the infection.
The student in this hospital, in this faculty, the faculty is where university, the faculty of medicine also knows the Limbe Hospital. Why have you abandoned our hospitals to go and do it in Douala and Limbe? We are not happy. You behave like somebody who has a shop, you have a shop, and you see your friend leaving the shop and going to buy the food in another shop. So tell us why you left us here to go to work and do the study, 2 referral hospitals in Douala.
Thank you.
And how did you choose those hospitals?
Thank you. I chose Goa because for convenience. My family live in Goa, get to stay in Goa. And secondly, the two hospitals that I choose is only for convenience. But I chose the two hospitals.
For convenience, and you think that it was a good thing because it is a bias. Normally you should have a select way to randomly select your hospital, and I think that you have said it in your recommendations. It should appear in your recommendations that you choose your, no, not the recommendations, the limitations. I'm sorry. That you choose your hospitals, 2 hospitals for convenience. Now, surgical site infections, and also on cesarean sections. We know cesarean section is one of the most commonly practiced operations in our hospitals. And also, surgical site infection is a very, very good indicator of the quality of the surgical care that you are giving to your patient. Just imagine a surgeon who has that bad reputation of giving surgical site infection to all the patients. understand that people will not go, because what the population knows, population did not know what you did inside, but they see what is outside. So it's very, very important to have chosen this topic because it is common. You have given the definition of the surgical site infection. You have said, say it again.
Surgical site infection is an infection of the surgical plate.
No, now I'm not getting you.
Surgical site infection is an infection on the surgical patient that can occur within 13 days of surgery.
30 days. And tell us now how you follow the patient. How did you follow them? How did you follow them?
So, if the patient was not yet if the patient did not have yet the operation, I can ask the patient the permission to be part of the study if the patient accepts follow from the theater on 14 days at the hospital. Due to the fact that the patient cannot stay in the hospital for 14 days, after discharge, the patient call the patient every day, every 2 days, I will send the patient to see how the patient how the wound is evolving over the 14 days.
And after 14 days, if anything happens after 14 days, what happens to that patient? The patient is not included in your study. It means that you have something to do there. Go back to the definition of operational terms and redefine your post-op, your surgical site infection and limit it to 14 days. Because your study stopped taking care of that patient, how can I say, 14 days after the operation. Have you understood?
Yes.
Now, let's say one or two things on your book. The book too is good. It's well presented. When you look at this book, show that it can last even 50 years in the library. The book is well written. The font size is good, the presentation is good. The tables, they have normal and good references. The numbering is correct. And as we all know, we are human beings. In anything that human being does, we have mistakes, because this is our nature. And as I said at the beginning, we are here to correct what we see as mistakes. If after my correction, I give this book to another lecturer, to another professor, you still find things to say in this book. So nothing is perfect here, what we are doing. And I'm going to share with you some of the imperfections that I noticed in your book. If you go to page 3 Arabic, page 3 Arabic, in page 3 Arabic we are talking about the research goal. You say research goal, but the first thing that you say in your research goal is that the objective was to determine. So what's the difference between a goal and an objective? Next sentence is what you should consider like your goal. Are you getting me?
Yes.
So can you answer to that question? What's the difference you make between a goal and an objective?
I think the objective is something that you need to achieve. The objective and the goal is
The goal is because the goal and the objective are different. In your study, the goal here was to improve outcome of women who undergo cesarean section. And now your objectives are the means that you use to achieve that goal. For example, your research questions and your research hypothesis. I have nothing to say about them. They are correct. Now, if I go to page 4, general objective, to assess the incidence and associated risk factors of surgical site infection following cesarean section in 2 referral hospitals. When I read this objective, naturally, if I use my common sense, I will understand that here you have 2 specific objectives, 2 main specific objectives. To assess the incidence and second one, the associated risk factors. Now, in the specific objective, we have added something else there. Number 2 specific objective, to compare the incidence of surgical site infection between Argentina and Douala Gynecology, Obstetric and Pediatric Hospital. This, for me, is not correct, because if you have to maintain it there, maybe change the title of your, because it does not appear in the title of your study. Your study is there to assess the incidence and the risk factors. Now you go and you want to compare Lacantini and Gynecoops in well. So you have to review it. Still in the same page. Research scope, I think that this is a mistake that the people were typing it there. The study was included, it's a mistake there. You see it?
Yes.
Research scope, fine. Now let's go to page 11. Page 11, and the rest of the pages, the rest of the review of the literature is well done. I'll go page by page so that you will follow me well. The review of literature is good. And now, let's go to the page 23. Page 23. Page 23, we talk about relative studies. It's well done. Because again, we have the author, the title, the study design, the main result, and the main conclusion. But here, I'm also disappointed because you have not mentioned the studies carried out in Cameroon. Some were carried out here in Cameroon. One was carried out by my colleague, Professor Alfredo. The reference number 3. When I see my colleague's name like that, should not like the list of related study. Another study was carried out by Bakwa. That study in your reference is the reference number 76. So those studies should be there in the related study because the studies were almost similar and they were carried out in our setting. And even our closest neighbor here in Nigeria, we have an abundant literature on this topic. I know of the studies of one very famous professor in Nigeria called Professor Akinola. If you go in your reference, it's reference number 7. So try to put those references there. If not, people will have the impression that you did well when you were doing the study. If you go to the chapter for materials and methods, study design, we conducted a prospective cross-sectional study. What is a cross-sectional study?
A cross-sectional study is an observational study done in a certain period of time.
It's not
Cross-sectional study is an observational study done on a certain period of time.
on a certain period of time. I'm not sure. I think that the examiner will come back and see exactly, and the prospective study.
The prospective study is for the new cases, rather than your prospective to go back to find.
Now, is it at the same time? Is it possible? Is it doable?
I think it's possible because prospective is a study design, and prospective is how that different study is doing.
No, give me an example. Give me what is prospective in your study, what is cross-sectional. I don't want to understand it well.
When I say prospective, it means that I did a prospective study means that I follow the patient for the new case. I don't have the disease, I need to follow for the disease.
So we were collecting the data progressively. Yes?
Now, conceptual study, it's the type of study that I did on master.
It's not the same. So explain. So this is where explain it in simple terms, using your study. What is prospective in your study? What is cross-sectional in your study?
In my study, our this was to follow patients for cellular psychiatry. So I followed patients for visiting for the disease which is cellular psychiatry. That is now, when I did prospective, for me, I don't qualify year ago to look for the disease. I followed the patient.
Okay. So that's okay. A good answer now. Okay. Still on the same page. Study setting. We say that talking about the Douala, Chimigo Ops, and Pediatric Hospital, we say that it is a public first category. Is it first category or third category? I'm a little bit confused. But people to know there, it is first. So you have to change it. It's not first, it is third. Third category. Now let's go to page 33. Exclusion criteria. In the exclusion criteria, you simply say the second exclusion criteria, pregnant women operated outside. Me, I understand. It should be clear that you are talking about women who are not operated in those two hospitals. Say it well, it's not well said. The sample size, the sample size determination and method, the formula, that sample size. We gave a reference for that formula. That formula, that reference, I want you to look at it. It does not match with the study. So get the original, I don't know me, the one that would fit with the formula. In here, the reference, the first reference, the first one, the reference zone. And here you have a study talking about the surgical site infection and associated factors. This is not a study concerning this formula. You have to find a specific one. I'm sure that Delo and Al, they just cited this formula in their study. So you go to get the reference that they got in their study, go look for it, and use that reference to put it in your book. For example, if I do a book, if I write a book, me and Dr. Elo, I write a book and I quote Dr. Nana's work. I cannot come there, you cannot come there and say it's not me. I use Dr. Nana. Now, so the study period was 3 months, I think so. So how do you determine it? The study period, how do you determine your study period? That's what they did. So it has nothing to do with the size, the sample size. Because normally, if you have a certain sample size that you should meet, the duration of your study, you should do the study as long as you have not met that number of cases. This is how you do it. So you don't just come and say, I'll do it for 3 months. And if you didn't those 3 months, you don't get the number of cases that you want. What do you do? So you have to do it like that. Now, we go to page 43. You have inserted a terminology that everybody cannot understand. The duration of interoperative antibiotic prophylaxis administration. What does it mean? Duration of page 43, first sentence. The duration of interoperative antibiotic prophylaxis administration.
I was thinking of duration of post-operative antibiotic.
What duration of
Duration of post-operative.
So you did your study, it was prospective. It means that you were in those hospitals. So how did you manage to be in those hospitals?
At the beginning, I was in another kind of hospital and village hospital. When I received the admission here first in the hospital. After I think someone a CTA, medical student from Ghana, to went me to stay at the hospital and I went to the practice.
Did you pay that young man?
Yes.
It means that you are a rich man. You paid him money. So since you were there, can you tell us the and post-op antibiotic prophylaxis that they use in clinical ops for a cesarean section?
The type of antibiotic.
Where is the protocol that they use for just for antibiotics?
In Ghana, the hospital and village hospital, incorporatively you use ceftriaxone, is third use of correspondence, or flamine, one of those.
Flamine, I don't know flamine. I know ceftriaxone. Flamine, I don't know flamine.
Amoxicillin carbonaceous.
How? When do they give it?
They use it before the excision.
Before the
Excision.
excision. And they give it for how long?
After the operation, they give it for 2 days.
For 2 days. I don't know. Don't forget that you have a member of the jury who worked there. So he will answer. And in La Quinchino Hospital, what is the protocol that they use?
We give 1 dose of ceftriaxone, a third generation of cephalosporin, and after the post-operative, they use ceftriaxone and metronidazole, or they use ceftriaxone.
Okay, do they use the same protocol for all type of cesarean section, emergency, or elective cesarean sections? Are there cases where they use simple antibiotic prophylaxis, or other cases where they use full antibiotic treatment? Antibiotic.
Like in the standard protocol is to give the antibiotic IV for 3 days and 7 days OR.
So,
All the surgery.
they use the same protocol in like engineering and because so it's also difficult to compare that if you are not using exactly the same thing. And just under this first sentence, we have another one. The duration of post-operative antibiotic prophylaxis ranged from 2 days to 17 days. 17 days of antibiotic. Same page 43. For me, it's not it's much, 17 days. Can you remember that patient who received since it was a prospective study? So what was it to do with that? 17 days of antibiotics.
It was 10 to 10 days.
10 days. Go and correct it, please. Because everybody who reads it will have the same reaction. You go to page satisfied, despite all the minor mistakes. And those mistakes, if you really want to correct them, you can correct them in less than 1 week. And I think that she did it.
Thank you very much, Dr. Edom, for your personal appraisal. I guess that you spend several hours go in detail in the interest of the candidate. Therefore, advice Amisa after the session to close to the handed is coming for. Who let it do? I'm going to play also the role examiner. By raising out another of anemia, as far as evidence-based medicine is concerned, is there a link between anemia and infection? Why?
I think when patients are anemia, there is hypoventilation level.
It should not be now a matter of thinking, because this is something that's a figure in the review of the yes, you are there. So you have there. Yes, because it's quite obvious to me that there's a link between anemia and infection. So anemia is a well-known risk factors of infection. Don't get any. Now, from what have been done, anemia has been written after regression as risk factors of surgical infection. I'm asking.
You must not do it. You must not do it.
Where is the table that conveys us? That table is where? Which page?
Page 48.
Okay. We also go to page 48. So, explain to us now, according to the statistical tools which appear on this table, and really, definitely, risk factors of infection is concerned. Raise your voice.
We can say on the table that the p-value,
It doesn't matter what we can say.
we can see on the table
Okay.
that the p-value is less than 0.05.
Too fast. Okay. Listen to me. Let's move gradually from OR stand for what?
Blood ratio,
And AOR stand for what?
adjusted blood ratio.
What's the difference between OR and AOR?
Blood ratio is are used to look for the significant association between the outcome and the risk factor.
So what? Okay, let's comment now. According to just the OR. What's the flow?
We have 4.7 at the level of anemia. Means that the patient who has anemia have 4.7 times more likely to have sickle cell
Yes.
than people without anemia.
Yes.
Now the p-value. The p-value is 0.03.
0.03.
0.03.
Yes.
This is statistical significant in our study because it's less than 0.05.
Yes.
Now the adjusted.
No, don't continue. So what about the CI here?
The confidence interval
Yes.
is 1.2
It's between, not our interval. Yes, between.
between 1.2 to 19.5.
Yes, from what else? Yes.
Our blood ratio is
No, what do you decide? Yes, well, your blood ratio is yes.
inside the.
No, it's not inside. Yes, inside it is true.
What do you say? And what else? This interval does not contain one.
No component.
Good. Therefore, what can we conclude from that quotation? That you see that you have a problem.
The anemia.
Yes, go on.
The anemia is more likely to give post-cellular.
This is the case. What now the role of adjusted flow ratio?
Adjusted only is used to confirm what.
Why do you want to confirm? You want to confirm because there's a possibility that this result could be source of some conform. You understand now?
Yes.
Good. So, listen to me carefully. So it means that from this study, according to the 8 adjusted flow ratio, the p-value, the interval confidence, anemia appears as the risk factors of, isn't it?
Yes.
But now, for me, it was supposed to be logical that if anemia prevents infection, the transfusion should be what? Should do what? To correct it, isn't it? I guess, as far as evidence-based medicine is concerned, according to the logical reason is concerned, it should be the case, isn't it?
Yes.
Now let's go now to the blood transfusion. So,
This page 15.
page,
50.
you have the floor. Go to the same process to explain to us.
Here we have a p-value.
Bit of water before you continue. Because this time your voice is decreasing. Yes, page 50. You are there?
Yes.
You have the floor for interpretation, as we did before. Go on.
On the page, on the blood transfusion, the oil ratio is 0.06.
Yes,
With people without blood transfusion.
please.
With people who don't have blood transfusion. And the confidence interval is between 0.01 to 0.
When you have odd ratio which is less than 1, it means what?
There's a protective factor. It's a protective factor.
Now, let's see if it's really a significant protective factor. Good.
I dropped them on
No, before just
a p-value of 0.006,
good.
which is less than 0.
Yes. What about the CI? It's between?
0.01 to 0.4.
Yes, it does not contain.
1.
Let me keep it. Isn't it?
Yes.
Now, moving now to the adjusted. Same tendency, isn't it?
Yes.
Therefore,
Therefore,
blood transfusion is a risk factors of surgical infection problems.
yes.
Protective factors.
The blood transfusion, people who don't have the blood transfusion, who are not transfused, are protected from surgical site infection.
No. According to this table, people who are who is the person to take care of the statistics? Because according to the organization of this table, yes, it should be appears as a protective factor because according to the rules of appreciation of odd ratio, it's well known that when the odd ratio is less than 1, it's a protective factors. Now you appreciate now the rest of information before confirming it. And this is quite important for you as far as the discussion is concerned and also as far as the recommendation is concerned. Because all of us are guessing that unless that blood is infected, you should not be honest. So, when you go through your analysis, there's no detailed information concerning the sterilization process of tissues, of tools, of environment, why not? In your site of study, you didn't have information. Who is taking care of sterilization? What the capacity of that person? You didn't go there. I know that you didn't go. Did you go to the sterilization ward unit of those hospitals and the main investigator? No, but nobody did. Have you observed those people there to appreciate how those people are washing their hands? It is true that a blind person cannot conduct another blind because he just can do. Among the aspect of washing hands, as far as this story is concerned. You understand? Just to complete what Dr. Elu had mentioned, because he was really satisfied because he tries to, there's some area of, there's some segment of the story, what you describe the environment as far as infection is concerned. Because from that simple aspect, you can reach to accurate recommendation. You understand? You are not inventing. Yes, we are not inventing. Attempt is matter of associated factors. In certain area is matter of risk factors. In certain point is matter of predictors. Understand? And I realized that we also mentioned the notion of associated risk factors. What is what I'm saying? If it is risk factors now, let's use the same yourself control. So you realize that also you have to endeavor now to comment your table. All the table should be commented. You understand now? Not discussed, but for all the table. Just each of key points on your table. And there's no reason for you that the table should endeavor that the table will just occupy the page. Unless your hands are not possible. By definition now, P value, that P is lower case. Comment your table, please. I'll give you key information. At page 39, two were excluded due to drop out. I don't understand that. What do you mean by drop out? No, we are dealing with prospective study. To reserve for us accurate information. They were excluded due to drop out. What do you want us to maintain as drop out? No, what is important is the reason of that dropping out. You understand what I'm saying? Yeah, the question is that. What's the reason? Not can. It's not about theory. It's not about your work. You have just true. That you retrieve, isn't it? The result of the reason. Because we are not concerned with 40 people. True. Why do you return it as a basic investigator?
The patient is going to give the explanation.
Yes.
The patient just start taking the call and respond to it.
Yes, they use an accurate word to express it. Understand?
I take a commitment that we are going to follow your remarks to try to make this work very good and publish it. Thank you also for the kind word you had for us. I'm going to start by the remarks of Dr. Elu, my good friend, whom I want to commend immediately because I can see that he went deep, very deep into the work, and he read the work page by page, meaning that it was very interesting. Most of the time it is when a work is interesting that you take all that time. So thank you very much. So you asked a question to the candidate. You wanted to know why she left Boya and Limbe and go to Douala. I think her answer is not very correct, madam. When you say it's by convenience in a scientific work, you would try to weaken your work. I don't think it is by convenience. Or if it was by convenience, it is in your mind. We, the supervisor, we had a good reason to follow you in Douala, and you yourself, you told us why you come here and say that it is convenient. No. Dr. Elon, thank you very much. It was a pertinent question. It is not just by convenience. Most of the work has been done in district hospital in Boya and so in the regional and the district hospitals. And we know that the incidence of surgical site infection after cesarean section is very high. Now, Douala, Gineko and Obstetric Hospital is a referral hospital. It is considered to be a milieu which mimic the Western countries, where you shouldn't have enough infection like elsewhere. The same like in Lakentini. So we wanted to know if in those two hospitals we still have that high level, and if yes, to understand the reasons so that we can target some strategic measures to reduce it so that we also resemble the Western countries. That is one of the pertinent reasons that makes you to choose Douala rather than Limbe. Of course, maybe somewhere hidden in your mind, the fact that your family was there is a good reason. We know that there are financial difficulties in Cameroon, we can accept that. But please, in scientific work, even if it is done, don't come and report like that. Dr. Elon also asked you a very pertinent question about the design of the study. Yes, he's worried about the prospective and cross-sectional. I agree with Dr. Elon because even in textbook, even among specialists, experts, there is always this confusion between prospective study being a design per se, or prospective being only linked to the moment you collect your data. And to make it clear, Madam, you may say you should know that a cross-sectional study is a study where you come at a given time, you take the information without any follow-up. Now it is retrospective because when you go into the file and you collect data which was collected by somebody else, you don't see the patient, you only take the files. That is why most of the time the weakness is that you have a lot of missing data. Prospective is because you came yourself, you saw the patient and you had your questionnaire and you were asking questions and you were filling it. There is no reason that you miss a data. So all the data which you want to analyze, but I also agree with Dr. Elon that it is confusing because they can say that the fact that you come on the 7th day and on the 14th day, it is a sort of follow-up. But the answer you will say is that you are not coming on that 7th day to ask questions, or you have not done any intervention between the two. You are coming on the 7th day at a given time again to collect your information. So it still respects the design of a cross-sectional study. And category. Douala General Hospital, Douala Gineko and Obstetric Hospital, Yaoundé, they are first category. In terms of category, they are first category hospitals. Lakentini is a second category, like Central Hospital in Yaoundé. When you talk of level now, it's the reverse. Douala General Hospital and so are the tertiary hospitals in terms of level. The study period, of course, yes, there is a problem, you should be precise. The period, there is a data collection period and a data reporting period, which are two different things, which are usually confusing in research. In your work, the two are the same because you did a prospective collection of data. So you collected your data for 3 months. Some in the retrospective study, when they do it for several years, they should distinguish between the data collecting period and the data reporting period. Of course, I agree with Professor Nana about the fact that your conclusion looks very good, that anemia, blood transfusion, and diabetes, it look very short. In fact, we accept the fact that you have not evaluated other factors who are usually associated to development of infection. And we know that there are up to 15 of them, which WHO has. You didn't target those factors. So maybe it is a recommendation that the next person will come now and evaluate. How did they shave the surgical site? What was the technique of cleansing the wound? What was the technique of even the surgical technique? Did they do bowel preparation? Did they take enema, give enema to the patient? Those are some of the measures which could be analyzed. And you will see that if you have analyzed that, you will not come out only with those 3 measures. But the design of your study and the short moment that you had was. Thank you, Mr. President, also on the risk of drug resistance, antibiotics that we use haphazardly. But there are many studies who have demonstrated that despite the fact that it is a single dose antibiotic which is recommended, several studies has been done to confirm and to accept the 48 hours antibioprophylaxis in low and middle income countries, for instance, because our antiseptic measures are not the most standard. Dr. Elon has started by congratulating the patients. Dress, she's not only dressed that way, she also walks that same way. She's a very hardworking, and I can confirm the president called me several times to say that I see your student here every time collecting the data, so I can confirm that she did this work. She was present at the site. I met her several times in the theater when they were cesarean section doing extra work and observing. So for that, distinguished member of the jury, Mr. President, I think that she will move from a good student to what I expect to be a very good doctor. Thank you very much.
Thank you very much, Dr. Chunzo, for your pertinent contribution. Opportunity for me to congratulate again the supervisor of this pertinent work. As you know, surgical infection is a big issue in our saying so, we are inviting the audience to appreciate the work of the country before inviting you again. Scientific exercise. So the panel conducted by I, Associate Professor Nanjamin, assisted by Professor Chunzu and Dr. Elon, the panel realized that Madame Isama did a good job. Overall, she did a good job, which will really contribute to alleviate the issue of surgical post-operative infection in our setting. It is the reason why, unanimously, we recommended her to the Senate so that she should be accepted in the very next days as doctors, as physicians in our country.
Le débat de nous avons aussi une qu'elle arrête son document. Tu ne peux ne pas faire une j'ai mis celui-là dans le...
Vous prenez des photos.
Invisible, God only wise, in life. light inaccessible, hid from our eyes. Most blessed, most precious, the ancient of days. Almighty, victorious, thy great name we praise. Unresting, unresting, and silent as light. No wanting, no wasting, thou rulest in might. Thy justice like mountains, high soaring above. Thy ways are fountains of goodness and love. To all life thou givest, to both great and small. In all life thou livest the true life of all. We blossom and flourish as leaves on the tree, and wither and perish, but not changed thee. Great Father of glory, pure Father of light, thine angels adore thee, all veiling their sights. All loud we would render, oh help to see, 'tis only the splendor of light hideth thee. Oh Lord my God, when I in awesome wonder consider all the worlds thy hands have made, I see the stars, I hear the rolling thunder, thy power throughout the universe displayed. Then sings my soul, my Savior God to thee. How great thou art, how great thou art. Then sings my soul, my Savior God to thee. How great thou art, how great thou art. When Christ shall come, we shout of acclamation and take me on. What joy shall fill my heart? Then I shall bow a humble adoration and there proclaim, my God, how great thou art. Then sings my soul, my Savior God to thee. How great thou art, how great thou art. Then sings my soul, my Savior God to thee. How great thou art, how great thou art. Then sings my soul, my Savior God to thee. How great thou art, how great thou art. Then sings my soul, my Savior God to thee. How great thou art, how great thou art. All the way to Calvary, he waits for me. My Jesus, he waits for me. My Savior, he waits for me. Oh. All the way to Calvary, he waits for me. He died to set me free. All the way to Calvary, he waits for me. He waits for me. Oh. He waits for me. He waits for me. He waits for me. He waits for me. All the way to Calvary, he waits for me. He dies to set me free. trust in Jesus, just to take him at his word, just to rest upon his promise, just to know thus says the Lord. Jesus, Jesus, how I trust him, how I proved him over and over. Jesus, Jesus, precious Jesus, oh, for grace to trust him more. Oh, how sweet to trust in Jesus, just to trust his cleansing blood, just in simple faith to plunge me neath the healing cleansing flood. Jesus, Jesus, how I trust him, how I've proved him over and over. Jesus, Jesus, precious Jesus, oh, for grace to trust him more. I'm so glad I learned to trust thee, precious Jesus, Savior, friend. And I know that thou art with me, will be with me to the end. Jesus, Jesus, how I trust him, how I proved him over and over. Jesus, Jesus, precious Jesus, oh, for grace to trust him more. What can wash away my sins? Nothing but the blood of Jesus. What can make me whole again? Nothing but the blood of Jesus. Oh, precious is the flow that makes me white as snow. No other fount I know, nothing but the blood of Jesus. For my cleansing, this I see, nothing but the blood of Jesus. For my pardon, this my plea, nothing but the blood of Jesus. Oh, precious is the flow that makes me white as snow. No other fount I know, nothing but the blood of Jesus. This is all my hope and peace, nothing but the blood of Jesus. This is all my righteousness, nothing but the blood of Jesus. Oh, precious is the flow as no other fount I know, nothing but the blood of Jesus. Softly and tenderly Jesus is calling, calling for you and for me. See on the portals he's waiting and watching, watching for you and for me. Come home, come home, come home, come home. Ye who are weary, come home. Earnestly, tenderly, Jesus is calling, calling, oh sinners, come home. Come home, come home, come home, come home. Ye who are weary, come home. Earnestly, tenderly, Jesus is calling, calling, oh sinners, come home. Oh, for the wonderful love he has promised, promised for you and for me. Though we have sinned, he has mercy and pardon, pardon for you and for me. Come home, come home, come home, come home. Ye who are weary, come home. Earnestly, tenderly, Jesus is calling, calling, oh sinners, come home. Come home, come home, come home. Ye who are weary, come home, come home. Earnestly, tenderly, Jesus is calling, calling, oh sinners, come home. Oh Jesus, I have promised to serve thee to the end. Be thou forever near me, my master and my friend. I shall not fear the battle if thou art by my side. No wonder from the pathway if thou wilt be my guide. Oh, let me feel thee near me. The world is ever near. I see the sights that dazzle, the tempting sounds I hear. My foes are ever near me, around me and with me. But Jesus, draw down nearer and shade my soul my strength alone.